Hi, everyone. My name is Ali Cheaton, and I'm a marketing manager at Definitive Healthcare. Thank you so much for joining us today for our webinar, How Healthcare Leaders Use Marketplace Intelligence to Gain a Competitive Edge. First, we'll have Luke introduce himself and talk about his background in the healthcare space. Then Luke will quickly give an overview of Definitive Healthcare and the data we offer. From there, we'll dive into the ultimate change drivers in the healthcare space right now. And then Luke will dive into what we're all most interested in, how our clients are using that data to stay ahead in the competitive marketplace right now. Once Luke is done, time allowing, we can go through some Q&A. So now I'll pass it over to you, Luke.
Awesome. Thank you, Ali, and good afternoon, everyone. This is Luke Landers here, and thank you for taking the time to join us this afternoon. By way of introduction, I am a director of sales here at Definitive, and I lead up a team responsible for selling our market intelligence platform to healthcare providing organizations. And really, we work with everything from hospitals and health systems to ASCs to independent practices to MSOs, imaging centers, technology-enabled care providers. I could keep going, but I think you get the point there. And just giving that quick rundown, while we serve a broad spectrum of care providers, and while the use cases vary, the end goal across all these client types, it remains the same. They partner with Definitive to really leverage our data offerings to ultimately inform and accelerate their growth strategy, pardon me. And really, before I get into an overview with some examples of how clients like you are currently using our data today, I thought an introduction to Definitive might be helpful. And really, about us, we've been around for 11 years. We're based out of Framingham, Massachusetts, and we are the leading provider of healthcare commercial intelligence covering the U.S. care continuum. Healthcare, it's constantly evolving and changing, and we act to deliver an accurate, comprehensive, contextual, and actionable view of the market to enable our clients to make informed and data-driven decisions. As for our offering, our data assets are accessed via a SaaS-based web platform, and even beyond the platform, many of our clients are integrating our data directly into their internal business systems to further analyze and operationalize. As for how we segment the space, we break it down by care setting and serve up varying views of which you can get a quick look at here, how we provision and out there's facility data as well as individual physician data. And before hopping into the use cases, I thought it would be appropriate to get out in front of a question that inevitably will come up, namely, Definitive, where's all this data coming from? Where are you getting this from? And in terms of how we go about building the picture of the market that we serve up, there's a few approaches that we take. First off, it's just government and regulatory data we're ingesting. Examples being the CMS cost report, the standard analytics file, pulling data from the NPI registry. It's all these massive amounts of data that we're turning really from volume to value, and it helps us establish an overall foundation at the base. Second, claims data. We've got partnerships in place with some of the larger clearinghouses here in the US, and we're receiving claims monthly that we then tie to the profiles that we have for these facilities or providers. And then really we serve up this data right within our platform and make it available. And then finally, it's Definitive's proprietary work. Wide range here overall. Some of this info we're gathering, we just collect it by brute force. We have researchers and data analysts that are making daily calls to facilities and groups to gather and confirm information. We'll also crawl the web for news items, press releases. This helps us stay on top of the ongoing merger and acquisition activity that's taking place within the market. But it's more than just data collection and data gathering. We're also analyzing it and learning from it. We use data science as well as AI algorithms that enable us to continue to learn from everything that we're collecting, make changes where warranted and appropriate, with the ultimate goal and mission being of serving up as up-to-date and accurate a picture of the marketplace as possible. So that is a quick overview on Definitive, and let's bring it back to the topic at hand. So the healthcare provider market, it's actually one of our fastest growing vertical segments. And a big reason behind that is that it's always changing, it's competitive, there's new challenges constantly arising. And in order for organizations to address and be nimble, they're finding that it's imperative to have a reliable data partner. And speaking of challenges, I don't anticipate anything that's up on the slide right here being a surprise to the audience that we have on the call today. But that said, I still thought that they were worth calling out. So myself and my team, we speak with healthcare leaders every single day. And while every situation is unique, there are some common challenges that constantly surface in our discussions. So first up, pandemic, big shocker, I know. COVID-19, it turned the world upside down, and in doing so, it absolutely crushed revenues and operating margins for provider organizations. AHA recently estimated that total healthcare losses in 2020 due to COVID were $323 billion, and they reported that nearly half of hospitals reported negative margins. And now it's not over yet. So patients are starting to return for care, and there's a whole host of new issues. Some of these patients, they've neglected seeing care for the last 2 years, and it shows. And not to mention just that, you're also dealing with staffing and resource shortages. So it's the challenges presented by COVID. They just keep evolving and keep changing, and it's, who knows what the next step will be. And then, you know, when it comes to the pandemic, it really accelerated some of these changes in terms of where and how patients are looking to receive care. And the audience on the phone, you see it. It's the ASC and urgent care market are absolutely booming, as well as the walls are down on telemedicine, the primary care market's consolidating, and there's these new types of tech-forward care providers that are cropping up on a near daily basis. So the challenge at hand, if how and where patients are receiving care is changing, it's really important to be able to offer services that align to what your patients are looking for, what they need, and not only that, but also knowing how to reach them as well. Next one, reimbursement changes. This one's a constant. Value-based care, it's, you know, the expectation is that you need to deliver higher quality care with improved outcomes at a lower cost. With that said, care coordination and collaboration is critical. So organizations, they're more proactive when they think about how they can grow, refine, and maintain their networks. Competition side, there's more options than ever before. How does an organization differentiate itself as well as retain and grow its patient base? And then as part of the competition, the market continues to consolidate. These consolidators have scale, resources, and funding. It's not enough these days to just passively sit on the sidelines and watch your lunch get eaten. And this is intended to be all-encompassing here. These are just a couple highlights of the challenges, and it is for sure a lot to manage through. And you know, with these challenges, they can be compounded when you're trying to navigate them, manage through them, determine strategy through them, and you have an incomplete view of the market. And really, to drive that point home, there's a survey this year by Huron Healthcare Executive Research, and they found that healthcare leaders are reported that one way they're adapted to the change and challenges within the market is by increasing their overall investment in data to ensure they might make the right decisions. And that is precisely what we're seeing here at Definitive. Aside from my team being awesome, there's a reason we have had such success and traction recently within the provider space. And the healthcare leaders we're working with, they recognize they need to make some changes to stay competitive, and rather than flying blind, they need quality data to inform their efforts. Hence, they find a Definitive, pardon me. So for the rest of our time here, I'd like to share with you a little bit about how healthcare provider orgs that are using our marketplace intelligence today to inform their growth and strategic efforts. And as I get into these examples, I attempted to complement them with some screen grabs from our platform. And I will caveat it up front here. The screen grabs, they won't nearly do our platform justice, as well as our data justice. But I don't totally trust my internet, and the last thing I need is for any latency to be loading up on the platform while I've got the audience on the call here today. So I appreciate you understanding on that one. So let's get into it. First one here, start with some fundamentals. When it comes to improving your ability to compete, it certainly helps to have a clear and deep understanding of the lay of the land. Who's out there? Who else is out there? And it could be simple things like, all right, how many short-term acute care hospitals are there in my market and what do the bed counts look like? Or maybe something like, all right, my biggest health system competitor, what does their network makeup look like? How many ASCs or urgent cares do they own? And for those particular facilities, like what do their volumes look like? Or maybe on the individual doc side, how many cardiologists are there actually in my market? How many are affiliated with us, employed by us? How many are affiliated with our competition versus the other players in the space? It is admittedly very simple stuff, but it's fundamental. It's important because once you have this complete picture, then you can start going deeper. And common uses of our data being looking at and understanding market share, comparing financial, clinical, and quality performance. And then not only looking at it currently, but it's how have things changed year over year? And what does that mean for us? And speaking of trends, with the claims data that we have that we're capturing and serving up within our platform, it gives a clear understanding as to what's happening with the patients in your market. Are there certain procedures or diagnoses trending upwards or downwards? And for that matter, what does that mean for us? What are we going to do about it? Is there an opportunity here? And speaking of opportunities, when it comes to growth, that could be either find service lines to expand based on the market need, or it could mean expanding geographically. And when you think about expanding geographically, moving into a new MSA or a geography, you might not have that same level of local market knowledge, intimacy, familiarity. And how we help our clients, we fill in those coverage gaps. We are a national platform and we help them understand, okay, I don't understand this new market I'm moving into. What are the dynamics of it? And that's where Definitive can support and how they're using our data. And as I move off the first use case here, quick screen grab I wanted to include. This is a local health system here in Massachusetts and its various components. And while admittedly a little busy up on the screen here, healthcare is busy. That's sort of the nature of the beast. I thought that this might be a good way to really convey the work that we do and the value we bring to the table when it comes to really mapping and clearly conveying network affiliations, roll-ups. How are all these groups tied in with one another? So quick example of it there, but let me move on. Let's see, where are we? Use case 2 here. All right, I'll leave with this. It costs more to acquire a new patient than it does to keep an existing patient. And when a patient has been previously seen within your network and ends up leaving to receive care elsewhere, those are lost dollars right there. Not to mention any missed opportunities when it comes to care coordination and improving outcomes. And as I look at the slide, I can and will acknowledge that I believe keepage is the preferred and more euphemistically positive term these days, but still, potato, tomato. The point remains, with all the pressure on revenue these days, once a patient's in network, it is important to keep them there. But admittedly, that's easier said than done. By its very nature, patients leaving your network to receive care elsewhere, it's hard to track if you're solely reliant on internal data. And that comes up a lot in the conversations that myself and my team have. Like, namely, what we've identified and what sort of has become clear is that provider organizations have a rock solid view of their own data, But when a patient leaves the four walls of their hospital, their practice, what have you, that's where the blind spots start cropping up. And that's really where Definitive can come in and start to fill in, okay, what's going on in the ambulatory space on that side? It's our data. It enables our clients to really home in and understand where, and equally as important, why patients are leaving their network. And here's a great example of how our data can be put to work. When it comes to identifying and understanding, the loyalists, splitters, and dissenters when it comes to referrals within your physician network. And could be that there's some troublemaker physicians that are constantly referring patients out of network, and maybe they just need a reminder of the overall value of keeping patients and referring patients within network. That can be hard to find if you don't have a data partner, and that's where we can help out, and that's how our clients are using us. But maybe it's more than just physician preferences. Do you know if there are certain procedures or surgery or even specialists that patients are consistently leaving the network for? Having that type of visibility and that type of understanding and being able to see those gaps, that really can help to inform strategy and decisions around clinician recruitment as well as service line expansion opportunities. Point is here, I guess, if you can't see a problem, you can't understand it. If you can't understand it, you can't address it. And Definitive, we make it easy for our clients to identify these areas of lost revenue so that they're able to do the important part of taking action to better shore things up. And another quick screen grab here. We track it both from like physician to physician as well as on the facility to facility side. And this here is just an example from our platform of a health system where patients had an inpatient stay and then later were treated at an out-of-network hospital. I include this here just because it's pretty staggering when you start to look at okay, the dollars missed out on and the dollars lost. These are real dollars and cents right here. So, all right, we talked about retaining patients. What about finding new ones? And that will bring us to the next use case here. Really, this one focuses on understanding referral patterns and tendencies and then taking action. And before I get into that, I'll take a step back as well. This referral data, it's admittedly tough to come by. In terms of how we do it and how we surface this type of visibility, what we do is we take our claims data that we're receiving and we perform a shared patient analysis using that data. This really enables our clients to view how patients are flowing to and from physicians as well as facilities. And it's not just the flow that our clients have visibility into, but because we are utilizing this claims data for this type of analysis, we're also able to provide insights into the diagnosis codes or the procedures associated with these referrals. So if there's certain CPT codes or surgeries or procedures that patients are leaving the network for, we make that very easy to understand and identify. So I mentioned that previously. Last slide, we talked about how our clients are using this referral visibility to find that out-of-network migration. But what about new patient sources? And this is where that data can be used to really trace back and identify your patient starts and put together a strategy to start having them sent your direction. So, easy example, let's say you are a group that specializes in imaging services, specifically around women's health, and you're looking to improve your referral marketing strategy and efforts. With a partner like Definitive, you can very quickly, A, identify all the primary care MDs within a given market, and then B, understand precisely who they're sending patients to for mammograms. And what do you learn? What do you see? Is there a group that's consistently sending patients to one imaging center, or is it really scattershot in terms of where they're sending their patients out for these types of for this work? Either way, whether it's one consistent partner or really a scattershot approach, what does it mean for you? And is there an opportunity to introduce your group and make a case as to why patients start being routed your way? And it's also that idea of sort of that coming to expansion efforts and where else you want to go. It's as you look into new markets, new geographies. Not only can we give you the full context of who's out there and what the incumbents look like, but what other dynamics can you understand? Like for those competitors currently in place today offering similar services, where are their patients coming from and what does that mean for you? And to give a quick example of how we do this on the referral mapping here, what I did is I pulled up a primary care group, and specifically I honed in on where they're sending patients out for x-rays. And you can see it's a little bit of sort of that scattershot approach type right here. The CPT codes are blurred out over here, don't mind that, but yeah, it's giving you the sense of, okay, these patients, we give a look at procedures, unique counts, and really understanding, okay, how do we take action here? What do we do with this at this point? All right, last one from a use case perspective. So with this slide up, service line, it's admittedly a term more commonly associated with hospitals and health systems, but I would argue that it really does play across all care settings and provider types, because at the end of the day, whether you offer a single service line or multiple, the goal is still the same, growth. And based on a couple of the other slides that I've covered, you can probably guess that serving growth through patient retention and acquisition is an extremely hot topic and a common use case amongst our client base. For the retention side, it's being able to identify who's referring in network, who's referring out of network, and why. Acquisition side comes down to identifying those groups, those providers treating patients that align to your high value service lines and being able to put plans in place to steer those net new patients your way. But take a step back, get more holistic and looking at the market. With a data partner, you can obtain a complete look at trends within your market, be it current and historical. You're able to identify, okay, which services are underserved within my region here and which service lines of ours show the greatest potential for growth. Its resources are limited, and it's really important and key to understand what is actually happening in your market so that you can ensure the investment to grow and market your service lines, your group, your services is a success. And then last one here, so this question of build versus buy. If you're looking to build out a new facility, where Definitive can help our clients, it really comes to understanding, all right, what's the need here within the market? What similar competitive services are already out there? And for the patients we're looking to treat, where are they coming from? What does that mean for us in terms of where we might want to build out a new location? Where is the need? And not only that, once the decisions are made, our data also helps our clients when it comes to recruiting new clinicians as well as staffing up their facility. And then on the other side of it, acquisition. Clients really use our data and insights in support of their overall market research, as well as the shortlisting of targets based on either synergies or their own areas of need. So as an example, let's say looking to grow your ophthalmic service line. When it comes to evaluating potential ASC acquisition candidates, Definitive can help to answer some of the following questions. How many ASCs are there in my market? Which ones are performing cataracts and what do their volumes look like? And for that matter, who are the docs that are performing these surgeries? Beyond that, which ones are independent versus part of a system currently? And, what other services are offered at each? And for this group as a whole, what does their payer mix look like? Do they have, is it commercially insured patients? Is it Medicare, Medicare Advantage, Medicaid? These are all factors that are important when it comes to making these types of decisions. And that's the visibility we are serving up to our clients today. And then just a quick example here. So I ran a search for ASCs in the Northeast performing the highest volume of cataracts so far this year. From there, within each of these ASC groups, we have profiles tracked on each that serve up answers to the aforementioned questions there. This is very much a simple and high-level example, but I wanted to convey how, this took me 6 seconds to pull in preparation for this meeting. So I just wanted to convey how quickly our platform and data assets can really be utilized to serve up insights, intelligence, so that organizations can take action. All right, that was all I got here. This was admittedly a very brief overview and by no means was intended to be all-encompassing, but if nothing else, if I can sum it up, when it comes to the prompts for the webinar today and how you can gain a competitive edge in the space, it really comes back to having comprehensive, flexible, and actionable data to support your efforts around research, determination of strategy, and then finally, most important, execution. So thank you very much for your time here, for your attention. I'll throw it back to Allie to see if any questions came up as we got another minute or two here.
Yeah, thanks, Luke. So we do have a couple of minutes and we do have some questions that came in. So I would love to ask and have you answer them. The first question we have here is, how is the data that Definitive has, so the data that we have, different from any other option that is out there?
That's a good question. That's how much time do I have again, would you say? Kidding. So in terms of what makes Definitive different, we're both simultaneously wide and deep in terms of what we track for the space overall from a facility side, a physician side. A lot of work and time that we spend is around just affiliations, building out what a network looks like, how docs roll into it. And this is not something that's static at all. This is something we are looking at and analyzing on a daily basis. I mentioned the claims data we're getting. We're looking at that. We're seeing, okay, for this particular doc, where are they billing out of? Who are they dropping claims underneath? It's this constant acknowledgement that the space is changing so that we take action to really monitor and keep things clean in terms of what the picture actually is. And not only that, I'll flip to the other side. I mentioned claims. Just our coverage from a medical perspective is so comprehensive, minimal. It's in terms of the coverage that we have, the covered lives that we're conveying. It really helps to paint a solid of what's going on out there.
Awesome. Thanks, Luke. We have 2 minutes left, so I'll ask one more question. How frequently is the data that you were showing today updated?
Yeah, okay. Good question. So multiple answers to that. Claims, we're getting those on a monthly basis. We're most current in the platform as of October 2021 is what we're currently reflecting in the platform from a claims perspective. On a research side of things, we're doing that on a daily basis, making these checks, making these changes. And then when it comes to some of the data that's out there from, CMS, for example, those are released either annually, quarterly. It really depends on which particular asset, but we're really doing this daily, monthly, quarterly, annually. It's a whole mix.
Great, thanks. So, we don't have any time left. So thank you, Luke, so much for your time today. And thank you to everyone who was able to join us today. I hope you have a great rest of your days. Bye.
Yeah, thank you all so much for the time here. If anything that we covered here today seemed interesting, you have more questions, you correct me if I'm wrong, Allie. I believe there'll be an email coming out from our marketing afterwards. You'll have the ability to request a meeting with somebody on my team via that. I encourage it. It's just, if nothing else, to have questions and learn a little bit more about what we have to offer. But either way, I think it's time today, and be well.